You're watching Cetome TV. Knowledge is power.
One of the common features we see a lot of in aggressive prostate cancers. Now, it's surprisingly how many times we get a patient come to us and they say, oh, my Gleason was 6. The doctor said, you're fine, everything's good. And then, a year later, the tumors come back full bore. And they say, I don't know what happened. Everything was supposed to be good. So typically, it's the genetic mutations that determine whether a tumor is aggressive, not necessarily the Gleason score. So one of the common pathways that is overexpressed in prostate cancers is the AKT-PIK-mTOR pathway. And we find that a lot of aggressive prostate cancers have something called PTEN loss or AKT or PIK overexpression. So basically, when P10 is a tumor suppressor that acts much like BRCA1 and 2 does, and when it's lost, the cells can grow uncontrolled. In fact, BRCA1 uses P10 to prevent cells that are mutated from growing and copying themselves. So uncontrolled proliferation is basically what we call prostate cancer or cancer. So a recent trial looks at AKT targeted drug called ipatasertib. It was in metastatic castration resistance. The preclinical data was really good. The trial has gone up and down. So it's beneficial in certain patients with certain mutations. We're not sure entirely what the outcome is for this drug, but there's other drugs in this pathway that are somewhat beneficial depending on what mutations you have. So you have to understand that a specific AKT inhibitor, ipatasertib, will only work against certain AKT mutations or mutations in that pathway. It won't work against all of them. And that's why sometimes these trials don't look as good as they do, is because they don't look at the different mutations. They say, well, this patient has this mutation and this patient has this mutation. And to give you an understanding, the scale of the possible mutations that you can have, we have 25,000 genes roughly. Some of those genes are 10,000 base pairs long. A base pair is the fundamental unit of DNA. There are 4 base pairs, and they're named based after the amino acid they're attached to. So you have C for cytosine, G for guanine, A for adenine, and T for thymine. And so it's the order of these base pairs that creates the structure of the gene. So when you change one of those base pairs, if you change an A to a T or a G to an A, then you're going to get a change in the structure of that gene, and that is called a mutation. And so a damaging mutation is what will cause the gene to become oncogenic, or if it's a tumor suppressor, it will prevent the gene from functioning properly. So just to look at the possible different mutations, the way to calculate the amount of mutations that are possible in a gene is you take a look at the different base pairs that can occur in that position, and that would be 4, the A, the G, the C, or the T, and you put that by the power of the length of the gene. And so if that gene is 10,000 base pairs long, some genes are 200,000 base pairs long. So if you have a gene that's 10,000 base pairs long, for example, then you would take 4 by the power of 10,000, and that would give you all of the possible mutations. So I don't suggest trying to do that on a calculator, but I will tell you, if you only take 150 base pairs, which is a minute little fraction of a gene, 150 base pairs, and you take 4 by the power of 150, the number is significantly higher than all of the atoms in the known universe based on hydrogen. So all of the atoms. So that's a massive number that can occur. So the amount of possible mutations in even just 150 base pairs, let alone 10,000 or 230,000, is just exponentially huge. It's a number we can barely look at. So one of the things with tumor DNA sequencing, it looks at all of the mutations and detects whatever mutation is occurring in that gene. So very important. If you do get tumor DNA sequencing, don't get what they call spot testing. Make sure that they look at the entire length of the gene, or as much of the gene as possible.
Thank you for watching Cetome TV. Subscribe below and stay informed.